Investigations by journalists and researchers over the past 2 decades have documented a troubling pattern in the United States foster care system. Children in foster care are prescribed psychiatric medications at rates that are dramatically higher than children in the general population. Some studies have found that foster children are prescribed antipsychotic medications at rates 3 to 5 times higher than other Medicaid-enrolled children. These are powerful drugs. They include medications like risperidone, quetiapine, and aripiprazole that were developed for the treatment of schizophrenia and bipolar disorder in adults. They are being given to children, sometimes very young children, for behavioral problems rather than for the serious psychiatric conditions they were designed to treat. The consequences of these medications in developing brains are not well understood because clinical trials for most antipsychotic drugs were not conducted in children and were certainly not conducted in toddlers or preschool-age children. What is known is that these drugs cause significant weight gain and metabolic changes that increase the risk of diabetes. They cause sedation. They can affect hormonal development. They carry the same risk of tardive dyskinesia, the permanent movement disorder that has been documented in adults. In 2011, a report by the Government Accountability Office found that foster children in several states were being prescribed multiple psychiatric medications simultaneously at doses that exceeded recommended guidelines. Some children were on 5 or more psychiatric medications at once. The children most affected by these prescribing patterns are often the most vulnerable. They have histories of trauma, abuse, and neglect. They move between placements. They have disrupted attachments. These are the conditions that produce behavioral difficulties. Medication can be appropriate when a child has a genuine psychiatric diagnosis and has been carefully evaluated. But investigations have found that some of these prescriptions are written after brief appointments, sometimes as short as 15 minutes. The children have no say in their treatment. Their parents, in many cases, have lost legal authority over medical decisions. The system that is supposed to protect them is sometimes the one medicating them into compliance.